We continue to see spikes in sort of folks reaching out for recovery and recovery services. And as we look into the etiology of it, we'll find, well, when I was at school, in the cafeteria, they said this. They said, this is what we were supposed to eat, and this is what we were not supposed to eat. And that kind of dichotomous thinking, black and white, this is good, this is bad, is going to be deleterious for all of us. And in the long run, for these children, starting to become malnourished and exposed to ideas about food as enemy so early on. Now, particularly when adolescence is about to commence for so many of them. We're talking about 10-year-olds, 10, 11, 12, puberty is happening, all the hormones are beginning to work and do all the magical things that they do, and the body needs the stores of food and fat, and because a typical young woman going through puberty is going to gain some 40 pounds over the course of puberty, because her body needs that, as does a young male. His body will need those nutrients stored up in order to navigate and negotiate the puberty years, when there will be growth spurts. And yet when folks now look at a child and they see a child who is a little chubby, or you were seeing on report cards now that children are overweight, and so now talk about valuation. We put on a report card what your body mass index is, and they're exposed to this, and and the realities are, if we do not allow their bodies to progress through this natural process, what are they going to have when the hormones of puberty say, okay, it's time for you to thrive? We have developed a culture in which it's never okay for children to be children and to go through the natural developmental and physiological changes that we really need them to navigate in order to have a very safe, healthy, and sustainable future.